But today we're here to obviously hear from Dr. Lindsay Blank. How long have you been at SHA, Lindsay? It's quite a few years now, but I'm not sure how many.
Yeah, terrifyingly, it's getting on for 20 years.
Really?
Yes.
Oh my word. Oh,
on
my
short-term
word.
research contracts, it can be done.
Yeah. Dear, dear. Anyway, say a bit more about Lindsay. So she's a research fellow at SHA, currently works on a project funded by the Joseph Rowntree Foundation, conducting a systematic review and logic model to investigate the links between poverty, stress, low-level anxiety and depression. She was previously a principal investigator on 2 NIHR-funded evidence synthesis projects, and also has previously worked as a lead reviewer on the NICE Public Health Collaborating Centre team. She was involved in a number of reviews, including ones about complex interventions around wellbeing for 0 to 4-year-olds, NHS provision of contraceptive services for young and disadvantaged people, universal interventions to promote emotional and social wellbeing in secondary schools, and interventions to encourage walking and cycling. So I think you could definitely say public health is in your blood, Lindsay. But anyway, I'll hand over to you now. Just give me a moment to change over the slides, and then we'll be ready for you. Just give me a second. Sorry, my MacBook being very slow. I'll get there.
I can do it for you, maybe it'll be quicker.
It's okay, I'm on it now.
Oh, okay,
Any second.
Oh, there we go.
Any second. Okay, over to you, Lindsay.
Okay, thanks Claire. Good afternoon everyone. Thanks for coming to listen. First thing I've learned is my own webpage needs updating, but I'll tell you a little bit more about what I'm currently doing at the start of the presentation, and then I'm going to tell you about a piece of work that we did to look at interventions to reduce the public health burden of gambling related harm. And this is systematic review work, so it's accumulating knowledge from evidence from research that's already been done. To credit my co-authors, Sue Baxter, Helen Buckley and Lindsay Goyder. And this work was a couple of years ago now, actually. It's part of a bigger centre, and again, I'll tell you about the centre as well. So we have to put the disclaimer up. The study is funded by the National Institute of Health Research, and this is just their statement to say that the information that I present and the views that I express are those of the authors and not necessarily reflected by the views of NHR or Department of Health and Social Care. So just very briefly, a little bit about me. As we've now established, I've been in SHA quite a long time as a research fellow in public health. And my interests really are around systematic review methodologies, novel ways of presenting systematic reviews. That's not massively evident in this particular piece of work, I have to say. And a particular interest in complex interventions and policy-focused reviews. So how can systematic reviews contribute to moving public health practice and medicine in general forwards? It's important to say I'm not an expert in problem gambling. And that's the thing with being a systematic reviewer in this kind of work. You're an expert in the topic only for the time that you're working on it. So your real expertise is in the methodology. Having said that, I've learned an awful lot about gambling very quickly, but I just want to reflect that because it's important to say this research is entirely independent. Anyone who's involved in gambling research will be aware of the huge impact of the gambling industry, the interest they have in the spending power and the way that that can potentially impact on research when they're kind of able to get in there and influence things. So this work was completely independent. Okay, so this particular review was part of the NIHR Review Centre, which is taking place in SHA. We've been involved for a number of years and it's running to 2024 at the moment. And we call ourselves the Public Health Research Review Team, and that's the website there where you can have a look at all of the different projects that are ongoing. So we've recently done a big piece of work around working from home and the impacts on health, both before and as a result of the pandemic. We just started some work looking at unstable housing and the health impacts, particularly on children, of living in housing conditions that are unpredictable. And really what we do, is independent synthesis and evaluation of existing research, so all systematic review, secondary analysis work. And the topics are informed by public suggestion. So NIHR put out periodic calls and asked people to suggest the kind of questions that they want answering or would be important to help their work and their practice. And then they get passed on to us. So really it's about helping planning the future of public health programmes and defining areas for further research as you move through the topics. So this work in particular, obviously you'll all be aware that gambling is a high priority topic at the moment for many national and local government stakeholders. Ever since we started this work, and I say it was a couple of years ago now, the interest in gambling, the media interest, the number of times you see it mentioned in the newspaper or on the internet has increased exponentially. It's clearly something that is a problem and something that has been picked up. And so NIHR identified a need to inform current policy making and also identify research gaps. So there's an awful lot of research gone on into problem gambling. And again, apologies, I know there's issues over the terminology around these particular cases. So I tend to use the terminology that was reflected in the research. So I'm sticking with problem gambling at the moment. I understand that some people aren't happy with that term. We can talk about that later. And yeah, so to inform both current policy making about what can be done to address those harms and concerns, and identify where research can help to move that forwards. And so what we did in agreement with the funders is a mapping review to understand what kind of research summaries had already been done in this area. So what we knew about what you could potentially do to start to address the problems associated with gambling. And then we suggested 1 or 2 questions where we could do a more focused review. And NIHR chose one of those for us to continue working on. Particularly important for all of the topics that we work on is stakeholder consultation. Both in terms of professional representation, so charity organisations, those kind of things that have an interest in the topic, but also individuals themselves, so people who have an experience of the particular issue or live and work with someone with those problems. We very heavily involve stakeholders throughout our processes. So although we're just working the secondary literature analysis, we're also very much making sure that it's applicable to people and that people who are involved in the particular concern. Okay, so as I say, we started off with what we sometimes call a review of reviews. So we wanted to know what kind of thing had been done to try and help people with gambling problems on several levels. Firstly, what had been done, and then secondly, could we tell whether anything was a better idea than anything else? What was the best thing to do to try and help these kind of people? And also particularly to understand where there were gaps. So where we didn't know what was good, or we didn't know what should be done, or if there's particular points on the pathway where that was a problem. So we had a number of stakeholder consultations, and in particular 2 PPI panels, so 2 patient and public involvement panels. One is a main panel for the whole centre, so people who contribute and comment on all of the topics that we engage in. We also convened our own panel, and that was of people with particular interest in problem gambling. So it could be someone who'd experienced it themselves, someone who'd experienced it as a family member. So, someone in their house had had that kind of problem and they'd had to deal with the fallout of that. We had representatives from a couple of charities of interest. And yeah, they did help to input and scope the work that we did. So just mention that briefly. There's 1 or 2 key things that changed as we were developing the protocol for the work. So as we were deciding exactly what question to ask and what kind of information to look for. And stakeholders influenced that in 3 key ways. First of all, in terms of the natural history. So the idea that it might start very suddenly. So very often, and certainly before I began this work, I would think about something like an addiction, a problem behaviour as being something that builds up gradually. So, maybe you bet on the horses a little bit as a bit of fun, and that becomes problematic over time. Maybe you join an online gambling site, don't use it much, but then something triggers you to kind of progress and to engage in those behaviours more regularly. It was also pointed out to us that sometimes it's very sudden. So, say if someone's in huge debt, they might just suddenly decide to blow all of the money they have left in the hope that they would get a win of some sort and be able to clear those debts. So it was understanding that there's not only one trajectory into problem gambling, and that people can come from all sorts of places and end up with similar problems. It also influenced the scope of the review. So again, particularly our PPI group pointed out that it wasn't just about harms being experienced by the person who gambles, but that it can hugely influence everyone around them as well. And that if we're talking about gambling harms, then we should be thinking about the impact on those people. And it's also particularly helpful, and you'll see later in the presentation, in terms of identifying what we call grey literature. So we tend to look initially for things that are published in the peer-reviewed journals, things that our big databases will give us access to. But in this case, we also picked up quite a lot of things from websites, training materials, those kind of things, which is harder for us to find. And our stakeholder groups are particularly helpful in identifying those for us. Okay, now I appreciate that this is not going to be massively clear, but it's a little bit of an aid memoir for me, just so I can talk you through the areas that we're interested in, and it is available in the references at the end of the document if you want to see it more clearly. So this work was done by Lindsay Goyder prior to the review starting, and what we were trying to do is understand where interventions might lie. So having a think about what was involved in someone who gambles and what stages in that process we might be able to say, actually, that's a point where you could do something. And so it starts off with the A over on the left, talking about supply reduction. So this is reducing opportunities to gamble. And there's a huge host of things there, which I'll talk about later. Demand reduction, so point B there, would be about educating people about what gambling problems are, so that maybe they thought twice about engaging in those kind of behaviours to begin with. So again, it's the before, if you like, before the problem occurs. Then we talk about C, upstream harm reduction, up at the top of the diagram there. And that's really about identifying people who are developing a problem before that becomes something that's having a massive impact on their life. So it's kind of at what point do you intervene and try and help someone before it becomes a major problem. We then talk about downstream harm reduction. So this is where a problem has been identified, possibly even some sort of diagnosis has been given, and that there's opportunity to work with those people to help them. And then E would be things around risk factor management. So this is really dealing with everything else that comes with the gambling problem, getting into debt, needing social support, having problems with housing, all of those things that can escalate, and that we should be able to help in that area as well. So as I say, this diagram was developed before the review, just to give us an idea of what we thought we might find. And again, it was influenced by our stakeholders and participants. Okay, so the objectives of the initial review, the first stage that we did, was to map out and broadly describe the published systematic review literature on the interventions to address or prevent gambling-related harms. So this wasn't about saying what the harms were, although there was a mirror review was undertaken by PhD at the same time, slightly coincidentally, and that is also available as well, which defines the huge scope and kind of what gambling-related harm is. And then the second stage was to use the results of this initial mapping review to make decisions about a focused piece of work. So where isn't there any review literature, and where could we contribute to the evidence? Okay, so very quick in terms of the methodology. We began with standard database searches, both medical and social science databases, and again the full list is in the associated publications if you're interested in that. We looked specifically for systematic reviews that had been published between 2012 and 2019, and this was because of the volume of primary evidence that's available. And what we wanted to do at this stage was, as I say, was scope out what the evidence was and identified the gaps that we might be able to contribute to addressing. And we looked, as I said, specifically for interventions to address or prevent gambling-related harm. So where had something been done? Where had a change been made to try and improve things? We found just over 1,000 records, of which 43 were potentially relevant. And then when we looked at the full papers, we actually included 30 of those reviews. And interestingly, 8 of them were published in the last 18 months of our inclusion dates. So that kind of indicates that this was really the time when the research was starting to take off, and this real interest in gambling as a public health issue was kind of developing at that stage. Okay, so I'll come back to this. This is from our publication in Lancet Public Health, and it kind of just gives you an indication of where the evidence sits, or where the review evidence sits, and I'll talk through each of those boxes in turn. And what we tried to do here, if you work from the green box on the left, I think it is, yes, you can talk about recreational gambling. So gambling that's done, people call it a bit of fun. I mean, you've heard all the slogans about, you know, when the fun stops and all of that business. So there's things that you can do kind of way before, or maybe even before people choose to gamble in any way, that might help prevent them sliding into that issue where gambling is a problem. You then perhaps move into problem gambling, so where people aren't completely in control of their gambling behaviours, even if maybe they don't realise that it's a problem at that stage. You would then move through the pathway into something that was diagnosed as a specific problem, and then hopefully, if they hadn't received support before, then people would receive support there to either achieve recovery or potentially, in the longer term, to experience relapse into gambling. And so what we did with each review is tried to sit it on that pathway and said, okay, with this particular interest, where does it sit? Is it about kind of these population level interventions on the left side of the diagram, or is it about something that's targeting an individual with an identified problem? And if you look down to the bottom boxes there, you can start to see where that evidence lies. So in particular, we found quite a lot of things about downstream harm reduction. So where treating someone where they've already got an identified problem. We found a lot less that defined public health related gambling. So said, you know, this is an issue for the whole population, and there are things that we can do at a population level to try and make it better. One or two things there where we thought we might find reviews and we didn't find anything, and that is about upstream harm reduction, so screening to identify people who might have a problem, and the right at the end there is about relapse prevention. So this is kind of longer term support for people who've been through some sort of rehabilitation program or support for their gambling, and we didn't find any reviews that looked at managing those concerns over the longer term. If we have a look at that, hopefully you see this a bit clearer in terms of the reviews that we found. So I'm going to tell you where the evidence lies and then give an indication about whether we can say anything particular about that evidence. So we first looked at the whole population interventions. So these are preventative measures where you take the intervention to everybody within the population and try to reduce the number of people who take up gambling in the initial stages. So we found 3 reviews on demand reduction. So these were educational interventions to reduce the demand for gambling in the first place. So trying to teach young people in particular about the risks of gambling and why they might choose not to engage in those behaviours while it was still very much a choice for them. And then we found 4 reviews on supply reduction. So this is interventions to limit the opportunities to gamble. Excuse me. And again, I'll talk in a minute about what those kind of interventions were. So in terms of the education reviews, as I say, these kind of education reach out, very early interventions for people who maybe haven't even considered gambling. At this point, we're all very much limited to children and young people. And they were all school-based education programs, so there was nothing reported in terms of, you know, social clubs, other things that young people do. They're all very much school-based. And the challenge here, it appears, is that it's difficult to know whether these kind of interventions would actually ever be able to prevent harm, because you're looking at children as a whole, and only a relatively small number of them, thankfully, are ever going to move to a level where they're gambling at a problematic degree. Of course, that doesn't mean you shouldn't do these things. It's just very difficult to kind of prove their worth in terms of that kind of intervention. In terms of supply reduction, this is one of the more populated areas for both the reviews and the number of primary studies that were identified in those reviews. So there are a number of things that are going on here. There's things around, one review particularly looked at just on-screen and posted gambling related warning messages. So this, if you like, is the equivalent of the warning on the packet of cigarettes. So, you know, somebody's undertaking the behaviour, but an attempt is made to warn them that what they're doing is problematic. In terms of electronic gaming machines, a second review looked at having time and expenditure limits placed on those. So again, that could be coupled with the on-screen warnings. You know, you've been playing for 20 minutes, do you need a break? Or you've spent a certain amount of money, so you can't play any longer. Those kind of approaches. There's then another couple of reviews that looked at a whole host of different interventions. So things like smoking ban within the venue. So people needed to leave if they wanted to smoke, and that limited their gambling. Things like not allowing machines to take large banknotes, again attempting to limit the amount of money that was spent. Removal of cash machines from venues, and other kind of messages and personalised feedback interventions that would try to influence the player as they were gambling. Obviously quite a lot of these are focused on the electronic gambling machines or gambling at an in-person venue. At this stage there was very little around kind of the internet gambling websites, those kind of things. There was a lot less being done. I don't actually know if this is still the case. I would imagine those interventions are now developing, but they weren't there at the time, or certainly not there in the review literature at the time that this work was done. We then found quite a lot of reviews of targeted interventions, so where people have already been identified as having a gambling problem. There was lots of therapeutic interventions, so things like cognitive behavioural therapy, and that was the single largest group of reviews that we found. We found 12 reviews in that area. Drugs interventions, so treating gambling very much as a problem that can be medicated in order to change behaviours. Some things about kind of self-help and mutual support, and then studies comparing one or more of these approaches. So therapeutics, as I said, this was the biggest area, and there was all sorts of things going on here, quite a lot of cognitive behavioural therapy, motivational interviewing, and other bits and pieces. And there were some internet-based therapies here, but that was about providing the therapy online, not necessarily as a response to internet-based gambling. Huge list of potential pharmacological interventions, potential drugs that have been administered in order to change people's gambling behaviours. And then, so briefly about the kind of self-help interventions. And so these were interventions that were instigated by the gambler and not the service provider. But they were very similar in terms of encouraging people to set either monetary limits or time limits on their gambling. Clearly challenges in doing that, but that was the kind of approach that was taken. And then there was a couple of reviews which were looking at one type of targeted intervention over another. We found absolutely nothing at the review level in terms of harm reduction, so where you identify people who have a potential problem and help them before that problem escalates. And also no reviews at all about interventions to support ongoing recovery and stopping people relapsing into problem behaviours. Okay, so back to the diagram. You can see there that what we were finding was mostly targeted at the individual level. So it was more about managing people who already had a problem than it was about kind of nipping things in the bud or helping people very early before they develop those problem behaviours. So briefly, in terms of the results, I haven't dwelt on the individual papers here, and again, those are in the associated publications. But in terms of the whole population interventions, it looks like there's a likely benefit of education programmes in the short term in terms of influencing young people's knowledge and attitudes towards gambling. But there's very, well, a complete lack really of long-term follow-up to know whether that influences behaviour over the longer term. And even though there's an awful lot of interventions going in around supply reduction and the potential of, you know, pop-up messages, time limits, money limits, there wasn't a lot of strong evidence to suggest that these were really working terribly well. Some indication that things that pop up on the screen when, you know, on a gambling electronic terminal might be useful, particularly where these were endorsed by agencies people respected and were used to getting health messages from. And in terms of the targeted interventions, I'd say there's a number of reviews on therapeutic interventions, and again, positive outcomes in the short term. So where people were receiving cognitive behavioural therapy had the potential to reduce their gambling behaviours, improve their lives over the short term, but far little indication about what that would do in the long term and whether those outcomes will persist. And really very little evidence to favour one particular type of intervention or one way of delivering it compared to another. So again, the evidence is there. There's quite a number of reviews, but it's difficult to really interpret what they mean altogether. And yes, evidence on pharmacological interventions pretty inconclusive. Quite a lot of work done, quite a number of primary studies in those reviews, but not really a great deal conclusive in terms of what they can say. Very limited evidence on self-help and very limited evidence to say that one of these things was better than another. But the reviews are up to date in that area. So in terms of us doing a more focused, structured review, those areas weren't particularly going to be the focus. Also some bigger evidence gaps in terms of kind of policy and industrial developments and what impact that will have on the type of interventions that could be useful. Very little in the studies at all about who these interventions worked or didn't work for. So again, moving forwards, it'd be important to think about kind of the impact of inequalities when you're doing anything to address gambling-related harm. And also thinking about unintended consequences. So, you know, if you change something, what impact does that have elsewhere on the person's life? They were very focused on the individual problem. Okay, so as a result of that, we came up with two focused review questions which could be asked. So two areas where there was a lack of systematic review and where we could do a little bit more focused work to answer these questions. The first one was what interventions were available to screen recreational gamblers for problems and how can they be best supported. And the second one was what interventions were available to support individuals recovering from a gambling problem or addiction and how can relapse after that treatment be prevented. Now obviously both of these are really important questions. NIHR chose for us to focus on the first one. They tend to be interested in the kind of more upstream questions. And so we agreed to do an additional focused review to answer that question. So I'm just going to tell you briefly about the findings from that. So yeah, we looked at interventions to screen for gambling-related harm so that you could identify people who are at risk of harm kind of before the effect of those harms were felt, and that you can maybe identify them slightly earlier in the pathway and provide the support that they needed. We looked at interventions in any health care and support setting, so everything from GP to kind of debt counselling and those kind of settings. And anyone attending those sessions would be eligible for screening for gambling issues. And the outcome measures being gambling behaviours and service use. Okay, and when we started to look at this, this term came up, so I just wanted to make sure that everybody's aware of the acronym as I use it in the next few slides. So the kind of interventions that we were identifying tended to come under the heading of SIBIRT, or however you want to say it. And so in this process, the professional, whoever they are, the GP or the debt counsellor or the social worker, would undertake a brief screening tool with the person in front of them to identify whether they might have a gambling problem, and then provide a brief intervention to support them. So obviously that requires that person to be trained in providing that brief intervention, whether that's, you know, speaking to them at the time about the problem or sending them information afterwards or whatever it is that's agreed. And this model also requires referral for treatment to some sort of gambling prevention support intervention. And so of course that support is required to be there. So it's not just about identifying the problem, but it's ensuring that the support for that person is available as well. Okay, so our focused review identified 9 primary studies, only 3 papers evaluating actual screening interventions. One was delivered in general practice, another in a mental health service, and the final one in a substance abuse treatment service. I'll tell you about those in a minute. And then we found 6 further papers which looked at feasibility of delivering interventions in those kind of settings. And as well as the ones above, that also include consumer credit counselling and social work. So those reviews didn't actually look at interventions, they looked at whether people would think the interventions were a good idea. Okay, so the intervention in the GP setting was a study from Sweden, where GPs received 2 days of training, and this was under the SIBIRT model. And then the participant, if they were identified as potentially having a problem, were offered a repeat visit to the GP to discuss the gambling. They were offered written advice on seeking report, and the practices received financial support for participating, so they were paid to screen people. The GPs were quite happy with the process. They didn't find the screening tool too onerous, and they thought it was valuable. However, it's noted in the review that the patients weren't always entirely truthful in answering the questions, and they were more willing to participate if they were asked by their normal caregiver or someone someone that they trusted had been part of the process. And really, that's not massively surprising when we think about, you know, GP histories, when GPs were first asked to talk to people about their weight or other behavioural issues. That was quite new. So it's not surprising really that people found it a bit strange that the doctor was suddenly asking about their gambling behaviours. The second study was in a substance abuse setting. I missed one. No. Okay, so the second one in a substance abuse setting, again, used a brief screening tool. And again, the same messages are coming out. So people were feeling uncomfortable, or some people were feeling uncomfortable about answering the questions. And they might be concerned about their responses being shared with their clinical teams. Oh, there we go. And then finally, there's an Australian study in a mental health service setting. And this one compared various screening instruments to kind of try and design the optimum tool to screen for problem gambling. But the message that comes out here is it was unclear what to do with the patients who'd screened positive. And so there's that important message where it's only relevant if you can support and refer the patient afterwards. So issues here with whether screening is a good idea if you can't provide that guaranteed support. So yeah, a few common themes really, which I think I've already mentioned. Practitioners were kind of okay with this. They were happy to get involved in screening people, and they thought it was a valuable thing to do. And there's a need for staff training in gambling-related harm to include better provision and understanding of referral pathways. So when they did identify a problem, that they knew where to send that person to. And yeah, there were some concerns around discussing gambling habits. patients just weren't used to doing that, and so that's something that would have to be taken into consideration. And obviously now we're all entirely used to, our GP talking about weight, smoking behaviours, exercise, all of those lifestyle things, but this was new for them. Okay, so what we also found, very briefly, to supplement that is a number of grey literature sources. And so this, as I said before, is things like online websites, training materials, toolkits for practitioners. And what appears to have happened, particularly in the US, is that interventions that have been developed for other things such as substance abuse have been transferred to screen for gambling. So they've altered the questions slightly to ask about gambling rather than other addictive behaviours. But what this means is, even though these tools are being used, they're not evidence-based and there's no information on their effectiveness or acceptability. So it looks like there's a really good intervention out there. It just hasn't been evaluated. And so obviously that research process needs to be undertaken rather than reinventing the wheel if there's things out there that could already work for this problem. Okay, so conclusions from the focused review is that kind of the healthcare and support services could be vital in identifying and supporting problem members. They're good places to find people, good places to identify them. And it appears to be feasible to do, even though there's some reservations on the side of the patient. It's something that could be built into those kind of professional roles. But the approaches that are being delivered in certain parts of the world would need evaluation for effectiveness and cost effectiveness if they were going to be implemented kind of under an NHS barrier or social work banner or social work banner or whatever it might be. And they'd have to be considered in the context of a clear treatment pathway for problem gambling. And I don't think that's something that we have yet. Okay, so just finally, last couple of minutes. As I said, we came to this work as non-experts, and sometimes it can be interesting to do that and to kind of see things that other people might not see. And so there's, one or two kind of overall challenges that I think the area has in terms of developing research and knowledge. One of those I mentioned at the start was definitions. So we got told off at various times for using the phrase problem gambling. Some people don't like that. But again, we were using the terminology that was in the papers we were reporting on. Some of our PPI representatives felt very strongly that it should always be gambling addiction, and that the only way for gambling-related harms to be taken seriously is if it was called an addiction. So, it gains the same status as kind of substance abuse addictions and those kind of problems. And that we need to be able to define and measure what the problem is. So, we've got to sort out the definitions, and we've got to know exactly what we mean and kind of what level is defined as being problematic. So again, with drinking, we've got alcohol units. We can define an acceptable level of drinking, what's an acceptable level of gambling, and kind of where should that level be. We need to know that there is support and treatment available. So when we are identifying people, that we can help them rather than just telling them that they've got a problem. We can learn from other addictions, if we want to call it gambling addiction, and it's not just about reinventing the wheel. There are things out there already. And of course, the huge weight of the gambling industry. All of these things really are drops in the ocean compared to the power, weight and influence that the gambling industry has, and that will have to be taken into consideration in all of the research moving forwards. Okay, so massively quick overview of the work. There's a number of references have come out of that, and there's more information in all of those listed here. And other than that, hopefully I'm okay for time, and thank you for listening.
Okay, thanks for that, Lindsay. As I said at the beginning, we take questions at the end. You can type your questions into the chat box, and make sure you put a Q in front of them just so we're clear that it's definitely a question that you want to kind of put to us. Or if you want to, I think it should be possible now for you to switch your microphone and or your webcam on if you want to ask a question in person. While we're waiting, I will just ask, at the end you said about the issues with using the phrase problem gambling, and
Yeah.
so was the pushback on that, was that coming from the gambling industry, or is there other preferred terminology? What would you say other than problem gambling?
I think one of the main point it came up was kind of in the reviewer responses.
Okay.
So everybody will be aware, you know, as soon as you put your work into peer review, you get all sorts of unexpected questions. And then although the literature that we were reading very much used the term problem gambling, it was the view of a number of reviewers that terminology was dated. And so, you know, it's finding a way to express that concern in a different way. And as I say, particularly our PPI representatives were very keen on using the term gambling addiction.
Yeah, I was just going to say, is addiction fair? Yeah. Okay.
But then, of course, some people feel that that's kind of stigmatizing the behaviour too much. So I don't know.
Yeah,
yes,
I can see Kylie in the comments has said we use the term harmful gambling in our work. So, okay, Greg, I can see you got your hand up. Do you want to ask a question in person? Okay, I can see in the meantime a question saying, are you planning to evaluate the cost effectiveness of the interventions as well?
Personally, unfortunately, no, we're not, because as I said, this is a time limited piece of work from an NIHR. I think in terms of where the literature stands, that maybe we need a bit more work before the cost effectiveness question might come in. Certainly the kind of things that I read, there was very little information around cost implications. So yeah, that might be a question for the future, I think, but it's not one that we're planning on answering immediately.
Okay, thanks for that. Sorry, I can see, Greg, you've got your hand raised. Can you maybe type your question in the chat if you've got one? Or are you there now? I can see a hand up. Okay, Greg, I've made you a presenter, which if you didn't have the facility to switch your mic on before, you should have. Okay.
Yeah, and I've made audio available.
Okay, I can see, Greg, you put your question in the chat anyway. Okay, so the question is, oh, you've got your tech issues, we'll pick up outside. Basic question, how much do you think industry-sponsored research frames the whole research space? I
think massively. Having worked on a huge number of different public health topics as a reviewer, yeah, it's enormous. The number of queries that we've had and invitations to speak at events which you then realise are industry sponsored. We actually had one slightly threatening interaction where we'd be told that we'd be, you know, empty chaired if we didn't come and present our research. And so, yeah, I mean, people working in this area in terms of researchers have to be really careful in terms of kind of autonomy and making sure that you understand exactly who's funding the research and where the research is coming from. Because, yeah, it's considerable, certainly, in terms of industrial influence.
Okay, thanks for that. Any more questions?
Was there a question just above that, Claire?
Oh, sorry, yeah, sorry, from Garth, yes. Question is on what impact the increase of the availability of gambling because of online gambling? Yes, huge.
Yeah, definitely.
Sorry,
I mean,
the impact of online gambling is having.
Yeah, what we don't represent in this work, because it was about the last piece of work that we did prior to COVID, is the impact of lockdown on gambling behaviours. And obviously that will be massive as well. And like anything else, it's kind of escalated the move to online. The other problem that happened as a result of lockdown, of course, was a lot of these support services disappeared. So where people were receiving in-person support for gambling problems, then yeah, that vanished overnight in some cases. And again, you know, some of our PPI group have talked to us about the challenges of that. But yeah, I think there's quite a bit of work now moving into gaming as a concept of gambling as well. So, you know, where you have loot boxes and those kind of things as another opportunity to gamble. Yeah, it's ever developing.
Okay, I've got a question from Hilary who says, did people who were screened by the GP have some red flags for gambling harm, e.g. distress, or was it all population screening?
It varied by the individual study. The one that I picked out to mention, it was there was kind of one or two criteria in the first couple of questions. It was almost like a pre-screen. So, you know, you'd decide whether this person was appropriate to be screened. So you wouldn't ask every single person who came in. And I think that was around, you know, kind of presenting for mental health issues, well-being issues, as opposed to presenting with, you know, a hurty knee or those kind of things. So yeah, there were some pre-screenings, and there's a variety, as there is with any of these type of things, of a variety of screening tools available. Yeah, that approach things in slightly different ways.
Okay, Jean asked a question, did you include industry funded studies?
We actually didn't find any. In the searches that we did, we looked carefully for the funding, and we were intending to think very carefully about whether we would include anything that clearly stated it had industrial funding. And actually the reviews that we found didn't have that. Now, what's problematic doing a review of reviews is determining exactly where all of those primary studies have come from. So I can't say categorically that none of the primary studies in the reviews were industrially funded, but certainly the reviews themselves weren't.